A man with fevers, rash, pancytopenia, and abdominal liver function. Definition: the pancytopenia is disease in which the patient has low levels of red cell, white cell, and platelets. Pancytopenia is also known as the syndrome of bone marrow failure. Bleeding from the blood vessel can lead to a small red spot on the skin called response. Many diseases can cause bone marrow failure, resulting in greater result to absent hematopoiesis with the subject pancytopenia. Inherent cause of bone marrow failure encompass a small but important group of these. Although this disease should always of the cancer as the potential cause of the new onset. Pancytopenia in children because they have serious clinical and treatment implications.
Pancytopenia is a medical condition in which there is a reduction in the number of red and white blood cells, as well as platelets. If only two parameters from the full blood count are low, the term pancytopenia can be used. The diagnostic approach is the same as for pancytopenia. Definition: anemia, hemoglobin less than 13.5 grams per deciliter or 12 grams per deciliter. Leukopenia, total white cell count less than 4.0 x 109 per liter. Decrease in all types of white blood cells. Thrombocytopenia, platelet count less than 150 A, 109 per liter. The disease is marked by an inappropriate and ineffective T-cell activation that leads to an increased hemophagocytic activity. The T-cell activated macrophages engulf erythrocytes, leukocytes, platelets, as well as their progenitor cells. Such finding is common in the syndrome, which is also referred to as hemophagocytic lymphohistiocytosis. Along with pancytopenia, HLH is characterized by fever, splenomegaly, and hemophagocytosis in bone marrow, liver, or lymph nodes. Iatrogenic causes of pancytopenia include chemotherapy for malignancies if the drug or drugs used cause bone marrow suppression. Rarely, drugs can cause pancytopenia. The antibiotics linezolid and chloramphenicol can cause pancytopenia in some individuals. Rarely, pancytopenia may have other causes, such as mononucleosis or other viral diseases. Increasingly, HIV is itself a cause for pancytopenia. Causes: familial hemophagocytic syndrome, aplastic anemia, Gaucher's disease, metastatic carcinoma of bone, multiple myeloma, overwhelming infections, lymphoma, myelofibrosis, dyskeratosis congenita, myelodysplastic syndrome, leukemia, leishmaniasis, severe fatal vitamin B12 deficiency, systemic lupus erythematosus, paroxysmal nocturnal hemoglobinuria, viral infections, alimentary toxic allergia, copper deficiency, pernicious anemia, medication, hypersplenism, osteopetrosis, low-dose arsenic poisoning, Sacco disease, chronic radiation sickness, Lig4 syndrome. Diagnosis: pancytopenia usually requires a bone marrow biopsy in order to distinguish among different causes. References: external links, EID Journal, CDC, December 2000. Ethiopancito Euro University Copyright Angers.
Applications in nursing. Discontinuing all non-essential medicines, yet vitamins B12 and folic acid. Dealing with broad-spectrum antibiotic for fever or infection. Transform red blood cell if the hematocrit less than 21%.
reduction in the number of red and white blood cells, as well as platelets. If only two parameters from the full blood count are low, the term Pancytopenia can be used. The diagnostic approach is the same as for Pancytopenia.
Pros and cons. Describe levels of blood cell cause fatigue in people who suffer from this condition. Pancytopenia patients commonly suffer from nosebleeds. There is visible pale skin of those affected. People suffering may also experience a decreased heart rate.
The DFA liver function test checks the health of a patient's liver using blood from a finger stick. This test detects a liver enzyme, alanine aminotransferase, or ALT, which is an important indicator of liver injury. Step 1. Preparation. Collect the materials needed to perform the test. The DFA liver function test kit, which contains DFA liver function test, read guide, single-use sterile lancet, microsafe collection and dispensing tube, and alcohol swab. In order to perform the test, you will also need these materials, which are not included in the kit: gauze pad, small bandage, gloves, and timing device, such as a watch or clock. Step 2. Perform the test. It is recommended that the patient washes her hands using warm water and soap prior to the finger stick. Have the patient sit down and prepare for the finger stick by hanging her arm at her side to facilitate blood flow to the finger. When ready to start the test, rest the patient's non-dominant arm on the table, palm up. The patient's hand should be lower than her chest. Gloves must be worn at all times while performing the test. Open the pouch and remove the DFA liver function test. Label the test with the patient ID number. Choose the middle or ring finger. Clean the patient's finger thoroughly with the alcohol swab. Wait for the alcohol on the finger to dry. Use the lancet to prick the finger. The puncture should be slightly off-center, as shown. Allow a large drop of blood to accumulate on the fingertip. If necessary, gently squeeze the sides of the finger to accumulate the large blood drop. Do not excessively squeeze any part of the finger, as this can interfere with the test. The test cannot be run correctly if the drop of blood does not contain sufficient volume. Hold the microsafe tube horizontally and touch the tip to the blood on the finger until the blood flows up to the black line. Capillary action will automatically draw blood to the black line and stop. The tube requires 35 microliters of blood to fill to the line. Do not squeeze the bulb of the tube when filling. Avoid drawing air bubbles into the tube. Immediately touch the tip of the tube to the white circle on the back of the test under the Add Sample Here label. Squeeze the bulb of the tube so that all of the blood dispenses from the tube to the test, and the entire white circle turns red with blood. Note the time when blood is applied to the test. If a sample won't dispense, hold the tube vertically and slide fingers along the tube over the vent hole between the black lines. Now position the tube over the white circle on the test and squeeze the bulb to dispense the sample. Bandage the patient's finger. Discard the lancet in the sharp object biohazard waste container and the microsafe tube in the standard biohazard waste container. Step 3. Read the test results. Read the test results in a well-lit area. Wait for 15 minutes after the blood sample application. Read the test at 15 minutes, but no later than 20 minutes. Do not read the test after 20 minutes. Match the color of the ALT test spot to the read guide. The test result for the patient is the number that is next to the matching spot on the guide, reported as units per liter. If the color of the test spot does not exactly match a color on the read guide, make an estimation between the two closest colors and report that value. Also record the matching bin, either less than 3x, 3 to 5x or greater than 5x upper limit of normal. After reading the test spot, it is important to confirm.
Conclusion. Is symptoms that are perceived to detain Pancytopenia shall go to the measure hospital to detain and diagnose survey. For hazy have the treatment available improvement. Thanks.